This patient was referred to me in 2013 for endodontic treatment of tooth number 31. Gold crown, and you can see a buccal decay. This is immediately after we did the root canal in 2013. You can see a nice bifurcation of the canal system there. And here's the date. And this is today, 9 years post-op of tooth number 31. Patient came in to see me for a different tooth, so we took a couple of PAs of tooth number 31 to make sure it was doing okay. And here it is, 9 years post-op of tooth number 31, showing tooth is symptoms-free, disease-free, and in full function. And here is the date. 9 years post-op of tooth number 31. This patient was referred to me in 2014 for endodontic treatment of tooth number 19. Here's immediately after we did the root canal in 2014. And take a look here, you can see that almost 90-degree angulation of the distal canal system. And I had some sealer extrusion, as you can see there. And here is the date. And this is today, 8 years post-op of tooth number 19. 8 years. Tooth is asymptomatic, disease-free, and in full function. What happened to all that sealer, you said? Is completely gone, harmless. So sealer extrusion does not cause endodontic failure. And here's the date. 8 years post-op of tooth number 19. This patient was referred to me for endodontic treatment of tooth number 12. You can see a large decay into the pulp of the tooth. So today went ahead and removed the decay, rebuilt the distal wall with composite, and you can see a distal access into the canal systems, 2 of them. And as you can see, everything went great. And look at all of these laterals. They're there, a whole bunch of them there. Everything went well. We temporized the tooth and referred the patient back to her dentist for the permanent restoration. This patient was referred to me for endodontic treatment of tooth number 5, porcelain crown. And you can see a periapical radiolucency there. So today went ahead and started and completed endodontic treatment in 1 appointment. And this is the post-op. Went through the porcelain crown. As you can see, 2 root canal systems. Everything went really well. We temporized the tooth and referred the patient back to his dentist for the permanent restoration. This patient was referred to me 4 months ago for endodontic treatment of tooth number 14. As you can see, there's a crown on the tooth and a periapical radiolucency there. Patient also had symptoms, and this is immediately post-op. So as you can see, 4 root canal systems, MB1 and MB2, 2 completely separate canals, distal buccal and palatal, and we have a bunch of laterals and anastomosis, as you can see here. And here's the date. And this is today, 4 months post-op of tooth number 14. Patient came back to see me for a different tooth, tooth number 3 on the upper right side. That needs a root canal, and we took a PA of tooth number 14. Everything is great. Patient has 0 symptoms now. He was extremely happy, and you can see the periapical radiolucencies have healed completely 4 months post-op.